It's become clear you don't have to physically have had COVID to get serious adverse effects from the lockdowns and the societal changes. How big of a concern is this in the medical community?
Yeah, Shepard, I'm really glad you took the time to talk about some of these big issues because they are really substantial. First of all, the long haul story is one that has not really been fully told, and one that needs to be, because we focus so much on the death. Practically every American could quote the number of Americans who've lost their lives from COVID-19. But that's the tip of the iceberg in many ways, because we have literally millions of people now, we're hearing up to a third, could have some lingering symptoms, and ranging in severity to a lot of pulmonary issues, even fibrosis on the lungs and chronic shortness of breath, heart arrhythmias due to inflammation in the heart. But the ones that worry me especially are the cognitive deficits. We call it brain fog, which kind of makes it sound like it's not that serious, but it is. People have terrible trouble concentrating, and this is why it's been so devastating, because it's been difficult for people to go back to work. And then there is all of the depression that goes along with this. So a huge amount of heavy psychiatric burden associated with COVID-19. On top of that is the other issue that you mentioned, which is the non-COVID effects of all the post-traumatic stress of living under the conditions that people are living with. So this is going to be with us for some time. Thank you for highlighting it.
Yeah, that sometime part, we've been researching this for quite some time. There's a lot of data, but some of it is missing. You mentioned the social issues, the lack of connection and the rest, and how we don't know how long that'll go on. But specifically, these lingering symptoms. Might people deal with this for the rest of their lives? Do we have any way of knowing?
I don't think so. I mean, this is a brand new virus, and when this virus first showed up in Wuhan, most of us, including myself, thought it was going to go by the same playbook as other serious coronavirus infections did, which that was going to be a serious pulmonary illness with high mortality. But we just never envisioned the neurologic complications, the heart complications, the clotting defects that it's causing, and a terrible coagulopathy, which makes it hard to oxygenate patients, all of the vascular issues, and the neurologic ones were especially surprising for us. But it's real, and it's profound, and remember the impact that this is going to have on our healthcare system and our economy. So as awful as the deaths are, and as heartbreaking as the deaths are, that is going to be only that one of many pieces of COVID-19 that will be with us. And it's also a wake-up call for young people that they don't want to get COVID-19, because, again, when we started seeing long-haul COVID, we thought it was mostly of people with severe illness. We're hospitalized now. We're seeing it in young people, and now that the variants are here, even young people with mild illness are having long-haul symptoms.
And before we go, one thing that we're noticing, and our researchers are in data all across the country, big cities, small towns, diabetes. It appears from looking at the data that there are diabetes cases directly related to COVID. What do we know?
Yes, so one of the things that we saw early on is this virus can get into the pancreas, because the receptor for the virus, the ACE2, the angiotensin converting enzyme receptor, is also in the pancreas, although it's not on the cells, the islet cells ordinarily associated with diabetes. So we're trying to understand, is there collateral damage caused by an immune attack on the pancreas cells that are not ordinarily involved in diabetes, but also attacking the islet cells. So this is a whole new area of research for diabetologists and endocrinologists to understand. But we're seeing what looks almost like type 1 diabetes that we would ordinarily see in kids and teenagers in people with COVID-19.
Shepard Smith here. Thanks for watching CNBC on YouTube.